Dear students, the shaken baby syndrome is a very interesting topic, but easily are underdiagnosed by most of the clinicians. The objective of today's video is to increase your awareness regarding this very serious disorder. Why I'm very loud and clear on this special topic is because of the nature of the disease. If the diagnosis was not established, then it leads to grave consequences and return of the baby in the same atmosphere, which leads to permanent injuries. Pediatric abusive head injury may have grave consequences, especially when it characterized by repeated acceleration and deceleration forces. The word shaken baby syndrome, death occurs in approximately 30% of the population, while permanent neurological damage in up to 80% of the victims, and retinal hemorrhages are observed are cardinal signs seen in approximately 85% of the population. The term non-accidental head injury is further subclassified under the heading of shaken baby syndrome, and it was described by Mr. Giffey in 1972. It has been estimated that nearly one-fourth of all hospital admissions in the head injury children younger than 2 years are the results of deliberately inflicted trauma. These patients suffer disproportionately severe injuries which usually resulted from violent shaking, and most of the time these babies are taken care by the caregivers who really don't know how to calm the babies, and this lack of calming effect leads to violent shaking. I have seen many times in my clinical practice that these babies have suspicious history with very serious injuries, and most of the time without external signs of injury. And this picture showed critical, irritable baby with no obvious signs of injury. Sometimes we appreciate some scalp swelling or some abrasions or sometimes tense anterior fontanelle. So history and physical examination of the babies usually presented with mild irritability, sometimes lethargy, or even in comatose status without external signs of injury most of the time. We have to examine in detail from head to toe and to check anterior fontanelle, and at the same time we have to measure fronto-occipital circumference. So what are the factors which raise the index of suspicion that help in establishing the diagnosis of shaken baby syndrome or child abuse? Are retinal hemorrhages, bilateral chronic subdural hematoma in the children less than 2 years of age, and third is skull fracture that are multiple are those that associated with intracranial injury, and fourth is significant neurological injury with minimal signs of external trauma. So how do we find the symptoms from the CT image? So CT scan brain show bitemporal, parietal, small contusions, and later on, the same baby, we have to end up with brain atrophy and further disaster followed by brain subdural hygroma. So in conclusion, the diagnosis and detection of non-accidental head injury usually comes to rest on proper history, detailed head-to-neurological examination, and radiological imaging. So if radiographic indicators of abuse or neglect are missed, it portends grave consequences for the child who will invariably be returned to the high-risk environment. So it's therefore crucial for the radiologist to be very familiar with the imaging findings of non-accidental head injury